right, welcome everyone. Thank you for joining us today for the continuation of our Decreasing Family Homelessness webinar mini-series. My name is Hyacinth McKinley. I am the Program Associate on the LCRC, and I'm joined today by my colleagues, Barbara Ledyard and Liza Porter. We always like to reiterate as we start our webinar presentations, really to focus in on why we do these, why we really try to promote these resources and discuss these different topics and issues as it relates to our work to fight poverty. And we like to offer these series and these events to you all to really build our capacity to fight poverty, because that's the heart of who we are, that's the heart of what we do. Community action, our goal is to help people help themselves and to change lives. And as such, we always like to start off, I know ladies in the room, if you'd like to help me join in. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and others. What our national webinar series entails, poverty approaches, and is a way to showcase innovative strategies. With that, we are very excited to continue to host this series with our partners, the National Alliance to End Homelessness. I'm going to turn it over to my colleague Sharon McDonald in just a minute, but I also wanted to introduce our other speakers, Marcia Baslow and Grace Whitney. We're very excited to hear from you guys, and we're looking forward to what resources you have to share with us. And just one quick housekeeping note, if you have any questions for our presenters, please feel free to enter them into the chat box, and we will have time for Q&A at the end. And with that, I'm going to turn it over to Sharon. You're on.
Hi, thank you all so much for joining in. I'm really delighted and honored to be on this call today, and also with my colleagues, Grace and Marcia, who are such leaders and so committed to this issue. So I just sort of want to start with a little bit of a recap of what we've done in previous webinars, and just to set the stage. So if you don't mind going to the first slide. So what we've discussed in previous webinars, which are recorded and accessible, and we also have some other material on the Alliance websites, really the framework for ending family homelessness has been shifting. We're seeing big dramatic, I think, changes in how money is being utilized, both in HUD policy and what's being directed at the federal level, but also rethinking at the local level how to best use resources to really to meet the needs of as many families experiencing homelessness as possible, to minimize our episodes of homelessness, to minimize homelessness altogether, and to prevent returns to homelessness. And part of that is due to kind of this a philosophical belief that we really, that homelessness is no place for children or for families to be, and the sooner we're able to reconnect them to communities with the right kinds of supports and stabilization to thrive, the better we will serve them. So largely, and again, there's been webinars on this in the past, but largely the framework that's happening is expanding rapid rehousing. So rapid rehousing, just as a reminder, is providing interventions that's tailored to help families reconnect to housing quickly through the provision of helping them with housing search, helping them with financial assistance to pay for rent for the time that they need, and the follow-up case management. We still see a role there for transitional housing, which is the more traditional kind of residential programs with services attached that's more long-term, but they tend to be 4 to 5 to 6 times is the cost of a rapid rehousing. So the idea is to target that resource where it's most critical. And given the scarcity of permanent rental assistance, which in all honesty, all families would benefit from that are low income, but knowing the scarcity of that, and there doesn't seem to be much alleviation coming down the pike anytime soon, really targeting that resource where it's most critical, where families otherwise would never be able to escape homelessness. And also just being more strategic and thoughtful around how we use homelessness prevention and dollars to really reduce the incidence of families becoming homeless. So previous webinars, but this is sort of setting the stage of what the environment looks like now in the homeless services field. So next slide. So what have we seen? We have actually seen some great progress. So one of my favorite models is in Spokane County, where they had families that were unsheltered at one point, a wait list for emergency shelter, and transitional housing slots that were being underutilized because families didn't meet the requirements to get in. And so sort of reconfiguring how they used their homeless services dollars, they expanded their rapid rehousing. They decreased some of the transitional housing, but they took other transitional housing and used it more for emergency shelter, shorter term stays, and they kept some long-term transitional housing and used that for families with much more severe barriers to housing, and also adopted more of a voluntary services harm reduction approach. So the results that they achieved there was what they described to me, one transitional housing provider said, was just a much more loving way to be with families. They were able to stick with families in that transitional housing program. But perhaps a more consequent result was in the overall, how the overall system functioned. So they saw a decline in the wait list for shelter. They saw a decline in the number of families that were sleeping outdoors because they couldn't get into shelter. And because they were serving more people with a lower cost intervention, they were able to nearly double the number of families they serve over the course of the year without adding new dollars to their system. So they had a big reduction on any given day in the number of families who were homeless, but that didn't mean that they were serving fewer homeless people. Over the course of the year, they were serving a lot more. They were just serving them more efficiently. So those are some of the examples that we're seeing that's giving us some encouragement over the country. Just a little sample. LA has seen an 18% reduction in family homelessness, Virginia, 38% reduction, Trenton, 70% reduction, and Houston, 39% reduction. Again, much of this is being done without new resources. So people are really being pressured to think more strategically about how they're using their homeless services. So next slide. So one of the things that's really important to us that we realize is that, you know, many of us in the homelessness world have been paying attention to housing for a very, very long time. But we need to support all the family members, and that includes the young children who are experiencing homelessness, as Grace would say. You know, there's more than one person in that family unit that's homeless, and so we need to buffer the impacts of dislocation and trauma on their lives and really offer as much consistency and support, both for the child, but also supporting the parent, so the parent can provide that kind of the stimulation and support and really buffer the young child and provide that stimulation that they're going to need in order to thrive over the long term. So one of the things as we think about this future orientation of rapid rehousing that's going to serve the most homeless families is going to be more and more, I think, the default intervention. We need to be thinking about how do we integrate interventions so that while we're doing rapid rehousing for families, we're also making sure that we're linking parents and young children to supports that can help them while they're in shelter, but even more important, perhaps, throughout that homeless episode, so that when they go to housing or they have multiple moves throughout their homeless episode, they have support and some consistency, and moms have the support that they need in order to provide, to make homelessness as safe as possible for their child. So next slide. So ACF, the Administration for Children and Families, have been doing some terrific work. I'm just going to hit some of the research that Marcia has been pulling together for us. We know that, almost half of the children who are homeless on any given, who use shelters over the course of a year are age 5 or under, and it's particularly prevalent around the youngest infants. We also are beginning to see, some impacts on children even before they're born due to the homelessness of their parents. So it seems to be associated with low birth weights for children, which has negative impacts on their future well-being. The association of being in distress in shelter seems to indicate that these children are actually in shelter are at increased risk of the use of physical or psychological aggression and greater incidence of that. And we've seen some research from Family Option Study, which is a piece that came out recently, looking at how shelter life and transitional housing interferes with the parenting structure and kind of that the lifeblood of family time, and so it becomes a threat to the integrity of the family that the parent now needs to rebuild when they go back home, when they finally get back into housing. So it's disruptive on many levels to both the parent and to the child and to them as a unit, and this is something that we need to become more aware of in the homelessness world. And I think in the early childhood world, we need to know how the services that we have at our disposal could be perhaps better utilized or targeted, or really serve this particular population who's very vulnerable. So next slide. And this is just more of a kind of a setup slide, because I think Marcia and Grace are really going to do the deep dive. But just some early things that we've seen coming down the pike is homeless service programs at localities are being asked to develop coordinated entry programs, so ways for homeless people experiencing homelessness to get access to housing interventions. We've seen in Philadelphia where they've integrated some early childhood development screenings into that system so that they're able to link almost at shelter intake families who both desire and require support, parenting support. And of course it's evidence-based, not some of the stuff that we might have done in the past that was sort of what we thought was good, but it wasn't necessarily brought by skilled practitioners. We've seen some states that have preferred access to child care for families experiencing homelessness, which allows mom to go look for work in housing, but it also allows the child to leave the shelter during the day and to be appropriately stimulated and being with other children and kind of creating more of a normal structure. And, we're not quite there yet, but what we're on the hunt for, so if you're doing this, we want to know about it, is places that are really working to build some of their interventions to end the family homelessness with a strong child-focused services. So they're bringing in the home visiting and other kinds of supports. This is the model that I think we would like to see emerge over the course of the next few years, so that we have a nice holistic intervention for families experiencing homelessness. And I believe, if we go to the next slide, this is where I turn it over to Marcia. And Marcia might still be muted.
No? Can you not hear me?
Oh, you're on now. You should be good to go, Marcia.
Okay. So I am in the office of the Deputy Assistant Secretary for Early Childhood Development, Linda K. Smith's office, and I lead the early childhood homelessness efforts with both Head Start and Child Care at ACF. And I'm really pleased to be able to share some information from the Early Childhood Development Office with community action agencies, because so many of you serve young children. and you are really our partners in doing this work. So we'll go to the next slide. Sharon actually talked about the fact that we have so many children under the age of 5 who are homeless, and the Department of HUD puts out a report to Congress every year, and they actually provide some statistics. And you can see this chart, which I always feel is extremely important to notice, that the person most likely to experience homelessness is in that first year of life, under the age of 1, and then it's very high from 1 to 5, and you can see that there's a dip, and it goes up and down. But clearly we know that infancy is still the greatest shelter use in America. Next slide. In 2016, ACF came out with the very first early childhood homelessness in the United States profile. It is on our website, and I think we have a link at the end. We're working on updating this. This has statistics from 2013, and by summer we will have an updated 50-state profile. Many of our early childhood community folks have told us that they have used this in helping them to develop and work on their community assessment, and so we hope it is helpful if you want to use it. I'm going to turn to the next slide. So I'm kind of excited about talking about Head Start, and I talk about Head Start because I do believe it really is a perfect match for homeless families. And so the information that I have on here is that we know that it provides comprehensive services that homeless children may not otherwise receive. And Sharon talked about being a buffer. And really, Head Start can be a buffer for some of the challenges that children experience due to homelessness. The Head Start focus is certainly on the entire family. It's a 2-generational model so that parents receive services as well as their children. And community partnerships put Head Start in an excellent position to work with all agencies serving homeless families. I think it's really why I feel that the CAP agencies are a unique group to be working on Head Start and working with the housing community, because you do have many times a foot in both worlds, and you can actually share information and collaborate together. And then Head Start programs are required to identify and prioritize homeless children for enrollment, allow homeless children to enroll while required paperwork is obtained, and coordinate with McKinney-Vento liaisons and community agencies. Next. So we came out with brand new performance standards on September 1st. Those of you who do have Head Start programs probably know that we actually had the standards out for public comment, and we had about 1,000 people submit comments, and then we rolled out the new standards September 1st, and I'm going to just give you a little bit of a highlighted piece and then go into a little bit more detail. But it talks about our community needs assessment every 5 years, and for the very first time, it really must reflect the needs of homeless children. Prior to now, we had always talked about really the community, but we hadn't ever really focused on homeless children. Homeless children are categorically eligible. That happened in the Head Start Act of 2007. And it's based on the ED definition of homelessness without the need for income verification. Head Start has a variety of flexible options for verifying and documenting a child's homeless status. So if you are working with a shelter and they know that a child is homeless, there may be some documentation that they can share with you, and there's some flexibility in taking that. Next. The newest piece is that, and we heard this loud and clear from the community, is that when children are homeless, Head Start programs are full, or there's no space, so they can't take them. And so what we now have is that Head Start and early Head Start programs may reserve up to 3% of slots for homeless and foster children. I'll go into a little bit more detail in a future slide. They must provide a grace period for families to meet the immunization requirements. We know that families who experience homelessness oftentimes don't have all the documentation that's needed to meet the requirements, and so there has to be a grace period to help families to go get that. And more than just give them a grace period, we really have to assist in helping them get the the immunizations they need. And then they must establish collaborative relationships and partnerships with the local liaison at the public school and the homeless service provider. Next. So I want to just spend a little bit more detail on the performance standards, and in case you are running a Head Start program, you'll actually recognize these numbers. We have recruitment of children and the selection process. And the goal certainly is to serve the most vulnerable children. And I think that's the key, because Sharon has talked about the fact that these children really are experiencing grave difficulties and that we want to buffer some of the experiences. So it's the most vulnerable children first and then strengthen the requirements. Children are homeless, children in foster care, and children with disabilities. And it has to be related to the individual community needs. Again, that's a link to the discussion around having a community assessment, and that will be done every 5 years. So there's some new pieces to the program. It clarifies the 10% of total funded enrollment must be children with disabilities. Program must identify efforts to actively locate and recruit the most vulnerable populations. That means that you can't wait for people to come to you. That means that you really, you go to shelters, you go to the communities where really they are looking for that connection between shelter and early childhood, and you prioritize younger children. Oftentimes what's happened in some of the states is that as the public preschools open in communities and 4-year-olds are going into the public schools or community-based organizations with public pre-K dollars, Head Start programs are moving to more 3-year-olds. And so we see that that's a possibility for the future. Next slide. In this slide, I want to talk about enrollment and attendance. And new for program, as I said, is reserving up to 3% of slots. Now, it is for 30 days. That means that at any given time, you can have 97% full, so that you can have a set aside for homeless and foster children and pregnant women. Homeless children can be served without the required paperwork for up to 90 days. That's a fair length of time, especially if the family support worker is helping the family to get the documentation that's needed. And again, I want to mention that you have to fill the vacancies within 30 days, even at the end of the program year. New this year in the standards is really a focus on promoting regular attendance. And part of that is that we now have more research on the attendance for child development outcomes, and the attendance of special populations truly emphasized. We need to have a system for ensuring a child is safe if they're absent without explanation. If they're absent and there's no contact, the family support worker needs to develop a system for ensuring that child's safety. And we really want programs to still analyze and address the average attendance below 85%. Head Start serves the most vulnerable children, and we want children to be there. Next slide. So I can't say a whole lot about the Early Head Start Child Care Partnerships because we're in the middle of a competition, but I can tell you that in 2014, we had $500 million that went into Early Head Start Child Care Partnerships, and I do believe that there are some CAP agencies that are running our Early Head Start Child Care Partnerships. It's been a collaboration of Early Head Start and child care, and it truly has been amazing. We've learned a lot. Those of you who might get the Early Childhood Development newsletter may have heard may have seen my boss's article where she talks about the work that we've done in Head Start and child care, and that there was a Head Start program going on a field trip, but that the child care children couldn't go. And we've figured out that really by blending these two together, we can make this work for all. And I'll mention that if you want to be on the Early Childhood Development newsletter, you can send me an email. My contact information is at the back. So we had 275 grantees. New grantees will be announced in 2017. 70% of the applications that we got in 2014 talked about homelessness, and 20% of those that were funded 29% of those that were funded actually had a plan around serving homeless children. So we do know that there is going to be an increase in children being served. Next slide. Those of you who also run child care resource and referral agencies through the CAP or child care at the CAP know that we had a reauthorization of the Child Care Development Block Grant in 2014, December of 2014. I'm not going to go into huge detail on what all that reauthorization meant, but I am going to highlight two key pieces. One had a 12-month eligibility policy, and one had training and professional development. And that really is around serving children experiencing homelessness. And the 12-month eligibility is really going to make a huge difference. Next slide. So this slide actually talks about the CCDBG Act requirements around permitting the enrollment of children experiencing homelessness prior to the required documentation. That had never been done before. Head Start had been able to have some flexibility, but now there actually have to be some procedures, training and technical assistance on identifying and serving homeless families, and really a key piece is the specific outreach to families experiencing homelessness. Again, I want to mention that those CAP agencies that are working with child care resource and referral agencies, that's a real piece to take on. And coordination with programs working with children experiencing homelessness that tie with the housing community is just huge. And final rule then, nope, you can go, that's okay. The lead agency is to collect and report on whether a family receives subsidy as homeless. We've never actually collected that information before. So if you've seen the 50-state profile, you'll see that we have data from the Department of Ed, and we have data from Head Start, but we didn't have any data from child care. And we won't have that until it's collected in 2017 and we get it in 2018. But it's the first time that we're really going to be able to have data. Go ahead. So the final rule defines homeless to be consistent with the definition in Section 725 of Subtitle 7B of the McKinney-Vento Act. It's the definition that's used by Head Start so that child care and Head Start are together. It clarifies that children experiencing homelessness shall be given priority for services. You know, some states have said that they're working on how to have that happen, but states are really clear, and they got the message that this is a requirement of the CCDBG Act. Requires lead agencies to coordinate with other agencies to help families receiving services, and so that means working with child care resource and referral agencies, homeless shelters, public schools, you know, lots of relevant agencies, and that the grace period be established in consultation with the appropriate health agency. Because child care, health and safety is often regulated by a Department of Health, it's really important that the child care and the health community work together on this. We can go to the next. So as if it wasn't enough that we actually had Head Start regulations go out and child care regulations go out, on October 31st, we released a HUD, HHS, Ed Early Childhood Homelessness Policy Statement. And the little bit of background that I can give you is that the SNAP's office at HUD is really very focused on wanting to elevate early childhood. And so 15 months ago, my boss and the director of the SNAP's office had a meeting with a group of us, and we talked about ways that we could really elevate this conversation. And one of the ways, although we are the federal government, it does take a tiny bit of time to get these things through. We do have a policy statement. I'm not going to go through the whole policy statement for you. It is about 40 pages, 20 pages of policy and then 20 pages of resources, but it provides recommendations on ways in which the early childhood homeless and housing providers at the local and in some cases the state levels can collaborate. So we have a number of key audiences. Next. I'm going to tell you a little bit about just the 3 recommendations, and then I'm going to really ask you to go to the policy, because I think that it's going to help states to think about their policies. It's going to help local communities to think about their policies. The first recommendation is to support a two-generation approach through partnerships. And it really, we've talked about two-generation approaches in Head Start, but it's really time for us to really look broadly at a two-generation approach. So we have to learn about each other's systems and programs. You know, I had to learn more about the housing community, and the housing community had to learn more about the early childhood community for us to be able to put this together. We want to educate each other and develop and strengthen relationships. And I think what you'll find is that in the policy statement, we have really very specific recommended strategies and activities. And the nice thing is that we also have some examples. So we've put some state and local programs in as examples so that you actually have a guide. And the next recommendation, next slide, is that we enhance childhood integration with coordinated entry. And you heard Sharon talk about communities developing the coordinated entry process. You know, they're busy, they're very busy, and they're not gonna run to you, but you can get involved. You can actually reach out and be part of that coordinated entry process so that early childhood is at that table. Implement phased screenings and assessments. That doesn't mean that when someone arrives at a shelter that you have to do every assessment possible, but it needs to be implemented in a phased process so that all children have screenings and assessments. Engage in the prioritization process, and really develop a two-way referral process. Sometimes what happens is that the early childhood community knows about families who are homeless, but the homeless community doesn't know this family. And so having that two-way referral and building a relationship with the housing community is really going to be a strong piece for providing high-quality services. And again, we give you examples in the policy statement from different communities around the country to be able to use as a guide. Next slide. And then improve, leverage, and integrate early childhood homelessness data. I don't know if I can say this strong enough. When we were beginning to put together the first 50 state profiles on young children experiencing homelessness, it was amazing how little data there was out there. And I think that it's often that the community themselves may have this data, and you may be able to put together a bigger picture, but set clear goals, collect data, and then use that data for messaging and program and system improvement. Don't just put it aside, but really analyze the data and see where the gaps are, and then share the data. Those who are involved in Head Start know that we have put out a lot of information about the importance of Head Start programs sharing data in their community. One of the things that we're going to do before I just turn it over to Grace is now that we've got the policy statement out, we will be working on information memoranda, hopefully from Head Start and from Child Care. And what I'm going to be working on is putting a resource guide together. So if you are working on a project that impacts early childhood homelessness and you have a best practice in your CAP agency, please let me know. Share it with me so that we can actually consider it as part of the resource guide. And so now I'm really pleased to turn it over to Grace Whitney.
Thank you, Marcia. That was a wonderful overview of all of the change that's gone on, and we're going to talk a little bit about what it means when you actually have to try to do something with all of this. But first, what I'd like to do is I'd like to share a little bit of the work that we've done here in Connecticut to really establish some of these connections and relationships. We're now on our third cohort. We've done 2 earlier cohorts of connections between Head Start and family shelter programs specifically, mainly around being able to child-proof those systems. As Sharon was talking about earlier, there's really an awful lot more that we could be thinking about when we're thinking about families as opposed to individuals. not only the children's needs, but the parent-child needs and the parenting needs. So really child-proofing and bringing some of those resources and supports to shelter programs, making sure that any of the children in those programs are connected with quality early childhood programs, primarily Head Start, but really any program that's a very high-quality program, because we know that children who are at risk need the highest quality of care available. And then strengthening cross-sector collaboration. And we've been able to develop some wonderful collaborations and connections between programs that have really resulted in some great increase in access for services. This past year, we've been working with a cohort of 6 residential treatment programs for mothers and their young children, and they are typically released into shelters when they complete their recovery. So if we can short-circuit that homeless relationship and really move them into not only stable relationships while in recovery, but stable settings when they leave recovery, then we can then address homelessness at an earlier point. And we've begun to really connect with our housing components, diversion and coordinated access, rapid rehousing folks, to be able to think about child-proofing those systems, as well as catching kids and making sure that they're enrolled in early childhood programs. Next slide, please. One of the things that we began to use when we started with our first cohort was a set of just issues or topics or areas that we wanted to explore a little bit more in terms of child-proofing those adult systems. And it really guided the work that we did and was able to educate, I think cross-educate housing and early childhood folks as to the kinds of things that each of the systems was focused on. And then Marcia and her office took that initial template and were able to expand it and crosswalk it to the National Health and Safety Standards for children, and created what is identified here as the Early Childhood Self-Assessment Tool for family shelters. This has been a wonderful tool for us to be able to kind of, as I said, guide those conversations, but additionally, it has links within it that are able to make available a really wide range of resources to any providers, whether they're early childhood providers or housing providers. So just being able to access that document on the web and going through the different sections of it and accessing those links is an education on its own. We've used some of this in interprofessional training and technical assistance, but we find that educating not only housing and early childhood providers together, but also educating, each educating the other about the kinds of things that they're doing becomes very helpful in terms of building those connections and collaborations, and then continuing to expand the resources. We've also had small grants that have been able to support many of these partnerships. Primarily what they have done in shelters has been able to really create more child-friendly environments, and not just, kind of homework settings or televisions, but really things for babies, getting down on the floor, being able to have baby items and supplies available within shelters. Our shelters did not have those kinds of things, and oftentimes didn't even have covers for electrical sockets. So sometimes being able to connect some of the early childhood resources to the shelters have really been able to make huge changes in settings. Next slide, please. I think one of the things that we have learned through these connections is that we thought we had good relationships before, and this was even within CAP programs that had both housing divisions and early childhood divisions. But as you can see, since 2011, when we began to be very strategic and intentional about those collaborations, we've had a marked impact on the enrollment of children into Head Start. This is a graph of enrollment based on homelessness in Connecticut Head Start programs in comparison to the national rate of enrollment of children experiencing homelessness. So clearly there's been an impact of the kind of connections that we've been able to make. Next slide, please. Next, that's been our experience in connecting systems, but I want to go through some of the things that have recently happened that really begin to highlight the policies that Marcia was talking about earlier. There's been a lot of change recently, and the three major early childhood policy platforms have been revised over the summer. She mentioned Head Start, the Head Start Performance Standards, the Child Care and Development Fund rules, but also Every Student Succeeds Act, the Elementary and Secondary Education Act was reauthorized, and some new non-regulatory guidance has come out recently, which all have a focus on the population of children experiencing homelessness, and all address the needs in early childhood and promise to really expand some of those resources. But because there's been so much change, it's even a lift for those of us who are in the early childhood field to understand all of these. So it's going to take some time and a lot of working together to move through thoughtful implementation and also be able to figure out how to create opportunities for being successful at accessing all of these services, and using these not only within the early childhood field, but within the housing field as well. So I thought I would go through several of the areas that begin to emerge as some challenges or some areas that need some attention as we begin to dig through the hundreds of pages of new language in the new policy platforms. First of all, within identification, there's the area of eligibility. We're finding that states now are exploring how they're going to determine eligibility, primarily for child care, because eligibility has been clear within housing and within Head Start, but the McKinney-Vento HHS definition is new to the child care field. And so here in Connecticut, we found our child care folks using the housing definition rather than the education definition, which could be a barrier to access to child care services, because we know that those definitions are very different, and we want to make sure that for our children we're using the early childhood definition so that we're able to access those services for all of them. The housing definitions are more narrow. That is something that we all need to be pretty understanding of as well, but we don't want to use those as a determinant for eligibility for education and child care and Head Start services, because we may end up putting up barriers to access. The next is determination. Who's going to really determine whether families are eligible? Some states are beginning to use a presumptive eligibility process where people within the housing community are able to automatically determine children as eligible and are able to share that capacity across systems. So what are the kinds of opportunities that might be able to be developed within states? But as we are just beginning to look at these now, these are areas where we may be able to have some and to develop protocol together. Another one is documentation. What is going to be needed for documentation? Could it be a statement from a shelter provider, or does it have to be some other kind of document that's going to determine that eligibility? Streamlining the process. And how we can, make sure that there are enrollment applications in a variety of settings so that the enrollment process is not necessarily, stressful and expanded, but really we can have immediate access. And then the prioritization. How is this really going to be done? Within Head Start, there's a system of points, a point system that's used, that's developed within each program, typically reflects what has been identified in the community assessment process, and identifying populations for focus. But parents and staff create point systems where they're able to select who are the families that are going to be the focus of the program and what are the families most in need. Will child care be using the same kind of a determining process? It's not clear, but those are the kinds of things that are still yet to be determined within states. Outreach. Who's going to do the outreach? Who do you outreach to? Do folks in the early childhood community know the people in the housing community and vice versa so that that outreach can be effective? Do we even know where some of the shelters are? Do we know where our coordinated access team may meet? How do we create those relationships so that we know who to outreach to? And then the enrollment process, what's necessary for enrollment. This gets into access, because we know that the states are really governed by licensing rules for child care, but some of those licensing rules don't yet allow the immediate access without documentation for access to early childhood settings, even for Head Start. And so those are some of the regulations that need to be changed in order to really provide immediate enrollment and access to programs, which of course children who are in public schools have. Immediate access has been available to within public schools for many years, that if a child is identified as homeless, they can begin to attend a program the next day immediately, and to get transportation to be able to do that. And then the ongoing access is also new in child care and for preschool in education settings, in that, as Marcia had mentioned, in child care now eligibility is for a year. And then also the stability piece of McKinney-Vento is really focused on making sure children are able to stay in their school of origin or the setting in which they have been attending. But now with ESSA and child care and Head Start, there's more of a focus on making sure children can maintain that stability within a program, so that they have that secure and ongoing base for themselves, and can, if a program is operated through a school system, be able to get the transportation services that a child in elementary and secondary school would obtain. But these are all new, as I said, so there's going to be a time that it's going to take to kind of work all of these things out and to figure out exactly how this is going to be done. So definitely the need for collaboration. It's going to take many people at the table to make sure that the systems and the processes that are developed to address a lot of these issues are really workable, that they actually can achieve the kinds of things that we need to achieve in communities, and they don't set up additional barriers. Next slide, please. And so this is a list of some of the changes, just to go through these again. ESSA now includes preschool as being a focus of local education agencies, so not only are children required to be immediately enrolled and have transportation to schools of origin in elementary grades, but also if the LEA operates a preschool, this falls under their purview now as well. Head Start is using categorical eligibility, but also now can save slots. There's new focus on prioritizing and coordination with the LEA and McKinney-Vento liaisons. CCDF, this is all new and requires prioritization of homelessness, aligning licensing rules, and addressing continuity. And then each state has an early childhood state advisory council, and this is new as well. This is something that now will require the involvement of the state McKinney-Vento coordinator, and in our state of Connecticut, those local McKinney-Vento coordinators are now required to be on our local early childhood council. So they're going to offer an opportunity for much more cross-training, and then more broad discussion of how to really address some of the needs of children experiencing homelessness. And Title I preschool also includes a homeless focus as well. The new ESSA is requiring new plans around the inclusion of children who experience homelessness, so another opportunity to be talking with potential new partners around planning for how all of this is going to be implemented. Next slide, please. So at this point, if you're wondering how on earth you could start, getting involved in some of this policy development and practice development in your state and community, here are some of the people who may be able to be contacts for you, and these are contacts that are available in each state or programs that are available in each state. So connecting your state-level representative and then looking for someone at the local level can be very helpful. But I'll go back to the joint policy statement that Marcia mentioned earlier. That is another absolutely excellent resource to be able to run through, not only to find resources and contacts, but also to get a tremendous range of ideas on how some of these things can be implemented in local communities. So I think that's it for me now. Next slide, please.
And
Okay.
Grace, it does have the link to our website that has a lot of materials also.
Great.
I think it's me, and so if you could actually just go to the next slide here. So before we open it up for questions, just a few updates from the National Alliance to End Homelessness, so around our work. Yesterday was a big election, and so at the Alliance we're still digesting that and what that means for the upcoming year. But in the short term, while everybody was out running for re-election, Congress did not finish their work on appropriations, and so there is a funding request at the House and the Senate to increase funding for the HUD homeless assistance programs, and that's the money that pays for rent assistance to help families avoid homelessness, to actually shelter them when they do become homeless, and to provide rapid rehousing or longer-term assistance if that's what they need, including transitional housing. So that's very important, and we're going to need some diverse voices. So if you haven't been involved in the past and would like to be involved, we're going to be starting a push, I think, in the next few weeks or two, because they're going to do this in the next couple of weeks. So do feel free to email me. The next administration and Congress, what we were really thinking about ramping up, and again, we're still digesting everything, was was just this realization that the housing world is not getting any easier for families with extremely low incomes, and we wanted to really work in the upcoming year to just scale up a response to make life easier, to reduce the vulnerability of low-income families to experiencing homelessness, and then when they do exit homelessness, to reduce the strain that they have, because most families who are rapidly rehoused are going to go back to living in poverty and paying a disproportionate amount of their income for rent, because that's what the housing market looks like for poor families these days, and that kind of instability is also not good for children. So again, if you're interested in kind of weighing in, if you feel like that's something you're able to do, please contact us. And and just to kind of go back to the top, I think, Marcia, Grace, and I have been working together over the course of the last couple of years, but it's really like, how do we break through the silos in the homelessness world, the housing world, and the early child development world, so we're actually leveraging each other's expertise and resources. And Grace reminded me yesterday, as we prepped for this call, that some of the community action programs are likely leaders on both of those issues inside your very own organization. And so internally, you could be working to build better bridges between the two systems to make sure that families are getting access to both resources. We are very interested in really developing our practice expertise, and that includes creating more of a child-focused lens into the homelessness work and the housing work, and improving the integration of rapid rehousing along with child development services. The way that the Alliance tends to work is not by thinking up fantastic ideas and telling people to go do it, but actually finding people who are doing really good work and elevating that, and having people learn from one another. It's like, oh, here's what we tried in Kansas. This worked really well. Somebody in Iowa might want to try that. So if you're doing this work, we want to hear from you. And we'd encourage you to try it, but this is something that we think has great potential. And then next slide is just quickly, at the beginning of this Decreasing Family Homelessness webinar series, the Alliance had developed a survey sort of to get a sense of where the audience was and their interest and their experience. So if you've already filled that out, don't feel the need to do it again. But if you haven't and you would like to weigh in, please fill it out and give us make sure you include your contact information and share some of the things that you've experienced that you would like to share with your colleagues, and we'll use that to inform our future webinars over the course of the next year. And my email address is up there, along with Cynthia Najendra, who is the director of our capacity building. So before I open it for questions. Marcia, Grace, any kind of final charges to the audience?
If I could just make a comment, this is Grace, if I could just make a comment about the connection between early childhood and CAP agencies. I know some of our most wonderful and productive relationships have then come out of CAP agencies who then really elevated and enhanced the partnership between units within their own agencies to create really wonderful models of what could be. We had one program that was actually able to then get an expansion, the Early Head Start Child Care Partnership Grant, where roughly 30% of the children who then populated that program were children from the shelter. So, you know, there's so many possibilities in working better together that relationship was really able to give them a sound grounding for being able to be selected to be funded and expanded. The other thing is that then those same CAP agencies have reached out into their community and made wonderful relationships with other shelters, the domestic violence shelters, substance abuse treatment programs that are not part of their systems, but then accessed those services for their populations as well. So they're just in such a good place to be able to just continue the leadership that they have for families who are in poverty in communities.
I think that's a great way to open it up for questions, because I think that we learn from you on the call, and we want to be able to provide you as much information as we can. If there are questions. And then I want to mention also, Grace had talked a little bit about some of the pieces around documentation and eligibility and trying to figure out all of that for Head Start and child care. And we will be having TA resources come out from ACF on eligibility and documentation, and hopefully those will be out soon.
Soon.
Well, ladies, thank you both for your very informative and in-depth presentation. We have a couple of questions that came in. First off, Grace, you talked a little bit about training opportunities that are available. Do you know about any other opportunities for prioritizing children facing homelessness, specifically ones that would be helpful for community action agencies?
Well, Marcia had mentioned the TNTA resources that are going to be coming out from ACF, but currently there are still some resources available on the Early Childhood Learning and Knowledge Center website that are focused on Head Start programs, and they really have been able to address the eligibility and selection area quite well. So I would first recommend those as resources. The other thing that would be advisable is to contact Head Start programs in your community to really have a conversation about what their prioritization process is, because this is something that they're very accustomed to doing. And it has worked well for them over the years, and I'm sure they'd be happy to share their process with you. Every program is different, so by just checking with several programs, you can get a couple of different ideas for how programs are actually able to accomplish that.
And my suggestion,
and if you wanted to contact, okay, if you wanted to contact programs in Connecticut, I'd be happy to refer you to some too.
If you do that and you actually reach out to the Head Start program, my suggestion would also be to include the housing community, so that would be your first opportunity to really bring people together. And you are the conveners in your community.
Excellent. Thank you very much. Another question that came in, what approaches or suggestions might you have about outreach efforts that would be successful?
Well,
so
this is, I'm sorry?
No, go ahead.
Well, this is Sharon. So I'm not sure if it's outreach from the homelessness world to the child development world or the child development world and Head Start to the homelessness. But if you are operating you know, a Head Start program and you're interested in serving more homeless children, you're being required to serve more homeless children, I think maybe one of the it's very first things you should do is probably just maybe make an appointment or have a phone call or have lunch or coffee with the person, the director of the Homeless Families Program. You know, there's probably not a lot unless you're in a very big city, and if you're in a big city, there's probably one coordinated entry system, and you can probably connect there, and just get you know, homeless programs have a lot of different kinds of things that they need to keep abreast of, and they're not always keeping abreast of everything that's available in their community that's available to young children, and so helping to bridge. I actually think it has to work in both ways. So if you're somebody doing homelessness work and you know, you need to find out where the Head Start programs are and just Google that. But I you know, we're all going to meetings, but we're going to different meetings, and we just need to get to meet one another and sort of start to explore where our interests coincide. And I think our interests coincide in that we care about children that don't have stability or safety and need support, and how working together can help us get there. Grace or Marcia, do you have anything to add?
Well, Sharon, I'm wondering, what we've tried to do a lot within early childhood for some of the housing programs is provide contacts or websites where contact information can be obtained. Is there a centralized location of all of the coordinated access networks or all of the housing leads in states? Or I wonder if there's a way to begin to circulate that information or develop an avenue for contact so those in the early childhood field really know where to go to connect with someone in housing.
Yeah, I mean, there is a HUD database that has like the COC leads you know, which we could publicize, and I think that you know, but I think it's probably just easier if you were to look in, you know, your county and just like look at the United Way, because they probably have it right there, and then you're going to probably get to the people who are sort of at the front line doing the work with the families every day, and that might be a good place to start. But we could certainly create that linkages, you know, but that might not be the linkage to the provider. That might work, you know, and in many communities, the sort of development of a coordinated entry system is sort of still evolving. So that would be really great for early child development folks to sort of be involved in early, to kind of think about how they could insert themselves into that to help facilitate access. But I kind of, my personal inclination is just to kind of to get to know some of the shelter providers actually as a first step personally. But I'm happy to figure out a way to get that link out there.
And another lead person might be the McKinney-Vento liaison in the school district, because they tend to be connected to both the housing and the education world and could loop in the early. They're going to have to be looping in the early childhood world more now.
And I
know that there is a listing.
Yeah.
I'm sorry, Marcia.
That's all right. One of the things in the policy statement that people can find is that we do have links to continuum of care programs, federally subsidized multifamily housing programs, you know, emergency solutions grant program. There's links so that you can learn a little bit more about the different housing programs that are out there. Likewise, we have links to Head Start, child care, home visiting, tribal home visiting, and Healthy Start, so that housing communities can also learn about that. But I do agree with Sharon that I think a lot of times it's that face-to-face get-together, and that's why convening a group to even begin a conversation, and then it doesn't have to always be face-to-face, but you've begun a relationship.
Great. Thank you, ladies, for your input on that. Another question that we got in through the chat, I know this is kind of broad, but if you could maybe just, any of you could speak to one or two examples that you might know of how agencies receiving rapid rehousing funds are getting creative with quickly rehousing their families.
So this isn't specific to the early childhood development, I guess. So, I mean, I think that, I think that rapid rehousing is sort of, it remains a model that's being improved upon as time goes by. And so the Alliance actually last month? It was about 6 weeks ago. We had a rapid rehousing summit where we brought together some diverse people from around the country to kind of to explore where we are in rapid rehousing implementation and where do we need to go. And so kind of very quickly, we talked about some of our data and research needs, including what are some of the broader impacts of rapid rehousing on a system. So I think we have some research looking at what happens to the individual that gets rapid rehousing, but can it kind of unplug a system like Spokane, which I had mentioned, which allows the program to serve more people over time. There's a need to kind of figure out how rapid rehousing is best tailored to unique populations, including survivors of domestic violence and young parents and youth, just people with diverse needs. And then there's a whole bunch of work that needs to be done around creating linkages like early child development. So, and this is actually where I think maybe some of the innovation is really happening and where it needs to happen. So, so I'll throw one out there. California has provided $47 million, which is fantastic, that's dedicated to provide rapid rehousing to families who are experiencing literal homelessness, so, sleeping outdoors or in shelter, to help them get reconnected to housing. And so the TANF agencies, so that's the whole welfare to work and the child care and all the kinds of employment services and employment supports, and often the homeless provider, but sometimes it's just the TANF agency, are working together to reconnect families, both to housing, but also attending to their employment needs. And so we still need to add in a child care lens. So that's the kind of work where I think we just have a lot more work to do, but where I'm actually most excited because I guess I have quite a few years in this field, it just has always sort of struck me that, when I started out in the field, the families, that there were public system resources, there were partners who helped us support families so that when they did become homeless, which was much rarer then, that we had the supports of multiple systems working together to help them. And I think over time, the homeless service field has taken on more and more and more of trying to meet all the needs of families. And as we create kind of maybe some of these service-rich interventions and long-term interventions, and we're really trying to meet all the holistic needs, which is great and aspirational and everything, but we've served fewer families, which meant that we're leaving a whole lot of families with nothing. And so anyway, we have a lot to work to do. I think one thing that we have covered, and we're happy to do again, is that we developed with APT Associates, with the VA, and with HUD, performance benchmarks and standards. So these were bringing together people. We reached out to people in the community, like how to do rapid rehousing well. And I think we need to encourage people to look at that document more. I'm happy to send that out so it could be shared with a group so that we're using our best possible practice knowledge when we're doing rapid rehousing so that we're getting the best possible outcomes for families. So I'm sorry that was a very long-winded topic, but we still have a lot to work to do to improve this intervention and make it as impactful as possible. But we think it's our best hope to really help as many people as possible get reconnected to housing.
Thank you for that, Sharon. And then before Grace
Yeah.
or Marcia, if you have anything to add. Continuing with that same question, they were wondering maybe specifically more about communities where there's a lack of affordable housing once the system ends. If you could maybe speak of any examples, you know, where people that are implementing rapid rehousing programs are doing some interesting things.
Well, I'll tell you, one of the things, and certainly we don't have this totally addressed yet, and I think we're just starting some of these conversations, but I know in Connecticut we're very concerned about safety issues for young children. And really, as I spoke earlier about child-proofing adult systems, one of the things that we want to be very cognizant of as we're using a rapid rehousing approach with young children is that whatever alternate setting we're considering for a family to double up, to stay with someone else, first of all, those are circumstances that are still homeless according to the education definition. So we want to make sure we're addressing some of the needs that the child might have in terms of care and education. They may be eligible for transportation supports. We certainly want to make sure that if we can support their continuity, if they are already in an early childhood setting, we'd like to make sure that they can stay there because it may be the only safe and nurturing place that they have available to them. The other thing is that there are a number of safety issues that we really need to be aware of when we're thinking of alternate places for families to stay. What are the sleeping arrangements? Our public health and early childhood systems are putting a lot of emphasis on prevention of sudden infant death syndrome, but that requires that children have safe places to sleep. And if they're sleeping on a couch with a parent or in an adult bed with a lot of comforters and things, they're at very high risk for SIDS. And so we want to make sure that we're thinking about the decisions that we're making from the lens of safety for young children and safety for all children. You know, are we checking to find out if a motel is really in a very inappropriate area for a young child or for children at all? So there may be an additional lens that we need to apply when we're thinking not only about this individual that needs to have a place to sleep, but this family that needs to have safety maintained for their children and health maintained for their children. You know, there are nutrition issues with young children. Their young brains are developing every minute of every day. Are they going to be getting the kind of nutrition that they need in that particular setting? Is there a need to bring in visiting nurse, home visiting, any other service so that while that family is staying with someone else or in another place, are they getting the kinds of services that they need? If they're in a shelter, at least there's someone there that they can be connecting with. But if they're in the community, they may not have anybody that is really able to help. So I think that those are the kinds of conversations we're having more of now so that we can really think about not only can we keep this person in the community out of shelter in a setting that may not be their own home, but a home, to is this family in a place that's really appropriate for the family? And I think that that's going to take a little bit more time. I know we're working with some of our housing case managers to make sure that we identify safe spaces if we're going to be identifying apartments or places for people to stay temporarily. Are those settings close to early childhood settings, and are those settings safe? And certainly with some of the computer-generated maps and that kind of things that we have these days, we have a lot of assistance to be able to plan around location, not just space. So those are just some of the things we're talking about. Have we got this installed completely? Absolutely not. But rapid rehousing is a newer approach, and so it's going to take some time for us to really be able to be thoughtful how we child-proof that entire system.
And this, you know, so I mean, this is, I think this is the topic of how to find affordable housing is actually a worthwhile topic, but certainly of a webinar or even a webinar series in and of itself. The Alliance does have some resources. I think we should just be honest and say it's an absolute struggle. So a big focus is having to increase families' income. It's also having to work carefully with the family to make sure that what's being done, what's being evaluated is they're going to be looking for something that they are going to be able to sustain, because you can't count on a subsidy being available. And so that might mean actually considering some kinds of doubled-up situations or shared housing kinds of situations, or living further away from where you had been, that, you know, where the costs have gotten astronomical. I think so. There's a whole pile of different kinds of techniques that people have done, including ways to kind of barter down landlords. But the housing market is as I said, it's sort of when we did the policy, you know, is not getting easier. I think the thing that I would say to folks is that for years and continuing today, most homeless folks are navigating that housing market all by themselves. And so, you know, what Rapid Rehousing is doing is providing somebody alongside them to help them navigate it and to help them make good decisions, like, you know, okay, so this is a cheap rent, but you're going to be paying, you know, the full, you know, utility. How will that all work? And so having these alliances across systems, you know, so the TANF and the employment sectors and the child care is all in there is good too. And then something that the Alliance we're very interested in is something we're calling progressive engagement across the homeless service system, so that when Rapid Rehousing doesn't work out, we have the ability to try and connect people to something long-term. But there's not enough long-term resources out there to go to scale. So you know, it really needs to work for most people. One of the things that seems to be true is that providing longer-term subsidies doesn't necessarily make life any easier, because it seems to sort of postpone the crisis moment. And so it's like, you know, okay, we're going to have 3 to 4 months of rent assistance. What can we be doing? And as stressful as that is on the family and the child and the provider and the agency and the system, that kind of urgency you know, is galvanizing, I guess, and that's sort of pressure that we need to actually get there, unless we're hugely successful in getting a new investment in housing resources to reduce the vulnerability of low-income people to, you know, their housing needs. But we have a long way to get there, so we'd love to have you partner with us on that.
Yeah, and I think the partnership is the critical piece, because there may be some resources within the early childhood field that are able to be accessed. Certainly I've worked with the child welfare system around some of this as well. And so I think by putting some systems together sometimes, there are ways that everybody can contribute a piece of this so that the children are safe, and so that the family is able to establish some stability. Not easy, but it's possible.
Thank you, ladies. And quickly, I think we have time for one more question. If any of you could speak briefly about any organizations that you know of that are working closely with healthcare providers to screen for the effects of toxic stress, particularly as it relates to the intersection of homelessness and early childhood development.
Well, there's SAMHSA. I'm not going to talk about organizations, but I can talk a little bit and mention at the federal government level, there's a SAMHSA State Youth Treatment Program and Project Launch, which is linking actions for unmet needs in children's health. And it's an initiative that funds states, tribes, territories, and communities to promote wellness for young children birth to 8. So you may want to check to see if your community has a Project Launch grant. They have supported 70 communities to date, and efforts to scale up successfully are more broadly being looked at.
Yeah, and I'll mention the IDEA and Part C, some states are focused more on prevention as well as serving children with disabilities, but there may be universal screening efforts that are being used in states, not only developmental screening but behavioral screening. So sometimes checking with your Child Find or Part C providers, they may be able to direct you to a local resource. And then the American Academy of Pediatrics is also looking more closely at the biological impact of toxic stress. We had a wonderful pediatrician come to an early Head Start meeting last month who is doing amazing work connecting with home visiting for families that he's seeing. So, and then the home visiting service providers, those are national networks of home visitors that are funded through the Maternal and Child Health Bureau to states, and there may be some home visiting capacity to connect with homeless service providers who then will go out and ensure that children are not only screened, but that families are connected with resources. But every community is very different, and so really being able to figure out what the early childhood resources are in a community becomes really the biggest challenge sometimes. But those are some possibilities.
And I think Philadelphia is the one place that I know where they've integrated the IDEA screening as part of their shelter intake, and have really looked at trying to build connections between the early childhood interventions in community and the homeless services programs.
Yeah, they have a more prevention-oriented definition for their services, and Massachusetts does as well. They do an awful lot of work out in their shelters.
Excellent. Thank you so much, ladies, for your time. And I want to again just particularly shout out our guests, presenters, Grace and Marcia. Thank you both so much for sharing your expertise and resources on this really important and critical topic for our network. Thank you both so much. And thank you, Sharon, for leading discussion and bringing this all together for us in a nice, neat package for us to digest. We really appreciate it.
All right. Well, thank you all. And again, feel free to reach out to, us at the Alliance and give input about what you'd like to hear more of and how we could be better resources for you. So we really appreciate the opportunity to really communicate with folks around the country who are really in the front lines of delivering housing and early childhood services. So I think I'm actually speaking for Marcia and Grace on that too.
Yeah.
We see such great opportunities here that we thank you for your time, and we would love to hear about your successes. So thank you.
Yeah.
Thank you.
So to reiterate, the two major resources that were discussed and shared by Marcia and Grace are here on the screen. You'll have a link. You can click on the link right there. It should take you right to it. Also, we got a few questions in about the slides. Yes, the slides and a recording link will be made available in a follow-up email, which will be sent out to all attendees of today's webinar. So we'll definitely share the wealth of information that was discussed today with you all. We like to also advertise other national webinar series events that you might be interested in that will touch on different policy or social changes that are in the pipeline that relate to your work with homelessness. And another open learning community group that we facilitate webinar series events with is National Poverty Trends, which is facilitated by the Center for Community Futures. And their next webinar series event will be held at the end of the month. If you would be interested in attending that, the registration link is available here on the screen, and you can also find that on the Learning Communities Resource Center page of the Community Actions website. Again, as Sharon mentioned, we really appreciate your feedback, and NAEH is really using that to guide the resources that they produce and also the materials that they share and present on here in this webinar series. So if you have any comments, suggestions, questions, and would be willing to share a little bit more about what your agency specifically does, please use the link here to share more about what you're doing. Of course, here is the contact information for the LCRC team. If you have any questions, if you'd like to get in touch with our presenters, please feel free to contact any of us. We would be more than happy to assist you. And finally, shameless plug, the Learning Community actually released our new blog back in August. If you haven't done so already, please visit it at lcrcweb.com to go check it out. All of the resources that were shared here at this meeting will be available there, and you can find a depth and breadth of resources, not just on homelessness, but some of the other topics that we focus on here at the Learning Community. With that, thank you once again to our presenters, and that will conclude our webinar event for today. Thank you so much for joining us.